Now that you have your strong list of questions and you're ready to get those questions answered, I want to talk to you about a situation you may run into. And that's when you ask a great question, but you don't quite get the information that you needed. So here are 4 tips that you can use in the moment. Tip number 1, I want you to go ahead and use those close-ended questions to clarify. This is a great opportunity to use close-ended questions because when you don't understand something or you feel like a piece of the puzzle was missing, you've got to pause and you've got to clarify so you are sure. Here's an example for you. You could say something like, Doctor, just to clarify, are you saying that the scan showed improvement or that things stayed the same? That way, you walk away from that conversation with full confidence that you know what the healthcare provider was telling you. Tip number 2, I want you to pay attention to subjective words. When someone uses subjective words, a lot of times, if we're on the receiving end, it can cause some confusion or some miscommunication. So, subjective words are based on feelings, experiences, and opinions, where objective words are measurable, they are facts. So, some of subjective words I want you to listen for are words like more or less, better or worse, increase or decrease. And there's a lot of them. So, those are just some examples. I mean, think about it. If your mom says, I want you to eat more vegetables and you're not eating any, well, eating one more a day would be more. But she doesn't mean that. She probably means about 5 to 8 servings of vegetables, right? Totally different perspective. So it's important to clarify. Now, here's an example in a healthcare setting. Let's say you go to the doctor with your dad and the doctor says, Frank, I want you to drink less alcohol. And you aren't quite sure what less alcohol means. So I would pause and I would clarify and say, so doctor, when you say he needs to start drinking less alcohol, can you be more specific so we're all aligned? And that's going to help you be a more influential and powerful advocate at home. Tip number 3, repeat or rephrase the question. I have trained so many reps to use this technique. Don't be afraid to repeat the question. How many times do we ask a question and then the person answering it does not even answer anything close to what we're expecting? They're going on a tangent and talking about something completely different. Most likely it's a misunderstanding. So wait till they're done talking, and then I would just repeat the exact same question because they didn't hear you correctly, or rephrase it if that's more comfortable for you. Ask the same question just in a slightly different way, and that may help them to understand what you're getting at. And tip number 4 has to do with when you run out of time, or maybe you just didn't have the opportunity to ask the question because you thought of it later. Oh, I hate when that happens. So there's kind of 2 different scenarios here. One is when the question is critical. You really need the answer to this question and you just didn't get the opportunity to ask it. So I would, if it's in a doctor's office, I would either call the office again after you've left, right, and follow up, or you can leave the physician a message in the portal. And if they're good at responding in the portal, I would go that route because then you'll get their direct response. You also can always ask another healthcare provider if by chance you have a follow-up appointment with someone else a few days later and you want it answered, in real time, like in the next few days versus a month or 2 later when you're going to see that doctor again. Now, if it's in the hospital, that's a little different. If it's a critical question you need answered, have the nurse call the doctor back. They are more than happy to do that. But if it can wait till the next morning, then I would ask during rounds. Okay, so add it to your list of questions and make sure you move that to the top because it's important. Now, that's only if it can wait 24 hours. If it can't, go ahead and call the doctor. If it's not critical and this has to do with a doctor's appointment, then again, just like in the hospital, put it at the top of your list and make sure you get it answered on the next doctor's appointment. Okay. So, like I said, these are tips that you can use in the moment to ensure that you get all of the information that you need. This is so powerful because when we have all of the information that we need, we can make better decisions and we can make them with confidence. And that means that we're going to get our loved ones the best care possible. Okay, go ask your strong questions. You got this.